as if all of these new taxes weren't aging the rich fast enough, did you hear about this? Now there is a double whammy if they want to end up looking better. This is true, because tucked in this Senate bill is essentially taxing the tuck. They're trying to wring more dollars and cents from those who get a nip and a tuck. A 5% tax on elective cosmetic surgery that the Senate bill predicts could yield nearly $6 billion. Manhattan plastic surgeon Dr. Jennifer Walden, not happy about this. Doctor, good to have you.
Hi, thank you, Neil.
How big will this be? How much would it affect your field?
It would affect our field greatly, and our societies, and me as a plastic surgeon definitely oppose this. You know, 90% of cosmetic plastic surgery patients are women. It's somewhat discriminatory. 87% of those patients make below $90,000 in their household income. So this is a working class tax, and Obama promised not to tax the working class, if you remember. And even more so than that 5% tax on a liposuction or breast augmentation procedure is that slippery slope of tax auditors and government officials telling me and other plastic surgeons who have trained for decades what is medically necessary and what is not. And that is a very inappropriate and not a good thing to be happening.
All right. Most people get this type of cosmetic surgery are not covered by insurance anyway.
Correct.
Right? So they've obviously committed to pay the money.
Correct.
And sometimes it can be significant. Like how much is you know, like let's say you do your neck or whatever. How much?
Probably anywhere between $8,000 to $12,000 when you total up the surgery.
So if they're going to pay $8,000 to $12,000 in cash, right?
Right.
Then it's not great, but it's another 5%.
Right.
Is it really going to stop them?
It won't stop them, because a lot of times people have a psychological attachment to looking good, don't we all? It's human nature, and they've been saving money.
Yeah, but some of them, it's not worth it. They come back after a while looking like cats. But.
Right, and that's the extreme. Most plastic surgery patients.
No, you're good. I'm sure you're very good, but I always wonder, well, this is the incentive you need not to do it.
Right, but most plastic surgery patients are mainstream America these days, really.
So what's the most common stuff they do, doctor, or you do?
Breast augmentation, breast lift,
How much is a breast augmentation?
Rhinoplasty with septoplasty. Breast lift is going to cost anywhere between $8,000 to $10,000. Breast augmentation between $6,000 to $8,000, depending on the amount of work done and the time spent in the operating room. So it's a small tax, but it is an added tax to a group of people that don't deserve to be taxed on medical care.
But you know how that's framed, doctor, that it's just the rich bowing to their conceit, and they're the target here. You're saying it's not that.
Right. This isn't, plastic surgery is no longer the realm of the luxury Park Avenue patient. These are actually mainstream women that work 9 to 5 every day that seek these procedures. If you could only spend a day in my office and see the working class women that are saving to look good, and it's not necessarily just to look like a Playboy bunny. It's because they have a severe breast asymmetry and they want an augmentation and a lift to correct.
But wouldn't that be normally covered and outside the realm of being just merely an elective surgery?
No, usually insurance doesn't cover that. They actually deem it cosmetic surgery.
But I mean, there's something in the bill, so much, and I didn't read this, so I had no proof of this, doctor.
Right.
That says that surgery like that would not fall under the elective tax category. You know what I mean?
Currently, Medicare and insurance companies do set the standard and say what they deem medically necessary and not, and currently they don't cover those procedures. They would cover breast cancer reconstruction, but for asymmetric breasts, prominent ears, a crooked nose, oftentimes they don't cover that. And that rings home the point of how can we have government officials telling us what is medically necessary and what is not if they can't even run the Medicare program as it is today effectively.
For you, what is it going to mean to your practice?
It probably will just mean, you know, you might see a slowing down of some patients getting elective plastic surgery. It might just see more frustration on the physician end as well, because as you could read in the fine print, they said if the patient doesn't play that by the time of surgery, then it's going to fall on the physician's shoulders. And that's not very fair either, I don't think. And so
it's mostly women this would affect, though, right?
Mostly women,
Most of your patients are women?
Absolutely. 90% of my patients are women, and that kind of mirrors the national statistics.
What about the men? When you have them in, what do they do?
Well, they get liposuction, sometimes facelifts,
Really?
rhinoplasty or nose job, and it's, you know, a commonly growing demographic in plastic surgery is men, and so it will also apply to men, but it does just show that it's going to be kind of abnormally stinted towards women and stigmatizing women who are getting these procedures done that are very common.
Interesting. Doctor, thank you very, very much.
Okay, thank you.
When we come back, a computer failure or a